Today we'll see about INICET FM recall questions. So the first question was from MTP. So MTP, like we discussed in the dopamine surge, the indication for MTP up to 20 weeks of gestation can be done with the recommendation of one doctor, and then for 24 weeks on the recommendation of two doctors. So here you have the first indication as rape, humanitarian grounds, or fetal anomaly found on ultrasonogram. So this requires a medical board that you all know, medical board consisting of OBG, pediatrics, and the sonologist or radiologist or any other doctor as specified by the medical board. So here the question is about consent. So consent with respect to MTP is 18 years, right? 18 years. So if the girl is less than 18 years, you have to get consent from the parents, right? So that's the first question. So next question is about age above 18 years can be found using. See, dentition ossification centers are all age up to early years. So secondary sexual characters, we use canvas staging. This is of course possible only in the teenagers. Okay. So dentition, the primary dentition and the secondary dentition. So with respect to dentition, you can identify age from birth till 21 years or 25 years, 70 to 25, where permanent molar erupts. Okay. For ossification centers, only up to 21 to 22 years, that is clavicle ossification, you can find. Secondary sexual characters, canvas staging only in teenage years. So age beyond 18 years, right? Age beyond 18 years, there are three. One is pubic symphysis metamorphosis, where you can find ages from 16 to 60 years, you can find. Then skull suture pattern, where the age from 30 years to 70 to 80 years can be found out. So age range from 30 to 80. Also, there is a skull suture called basi-sphenoid to basi-occiput that is possible 18 to 21 years, basi-sphenoid to basi-occiput fusion, where you can find age of an individual. So here the ideal answer will be pubic symphysis change. Otherwise, if the option has Gustafson's method, Gustafson method also, you can find age above 18 years. So answer will be pubic symphysis changes, skull suture pattern, right? And third is sternal element fusion. So sternal element fusion. So first is pubic symphysis. The second is skull suture pattern. So third is sternal element fusion. So with respect to dentition, you have Gustafson's. All these methods are used to find age above 18 years. And third is privacy of personal data and medical records is dealt under. See, this is a recent advancement with respect to a law where DPDP Act, you see, digital personal data protection act, right? So digital personal data protection act. So whereby there will be a digital data of a person, personal data, of course, personal data of a. So where there will be a manager, those who keeps the records are called manager. There shall be a fiduciary relationship. So all those responsibilities lies on the data manager or the institution where all the records are kept. See here the catch is personal data. Also MTP, where you should keep all the documents as secret documents. That is also there. Document as a secret document, not open to public or others, where data is pertaining to MTP, right? MTP. But the word here is personal data on medical records. So the word personal data, answer should be DPDP Act, Digital Personal Data Protection Act 2023, right? And then chronic mercury poisoning manifestation includes, see, tremors, the coarse tremors, right? See, mesaline was in arsenic, mesaline, arsenic, and thallium. Then basophilic stippling of RBCs, right? Also in punctate basophilia, it is called punctate basophilia or RBC retinal stippling of RBC due to heme synthesis. Heme synthesis, lead poisoning, is lead poisoning because of heme, deficient heme synthesis, right? Anemia is also common with lead poisoning. So the answer for chronic mercury poisoning, Mad Hatter disease or glass blowers shake, like tremors, coarse tremors, chronic mercury poisoning, right? Then old seminal stain on garments can be detected using. See, answer here I have shown you the reference, Case and Reddy, edition, 35th edition. See, answer is creatine phosphokinase test. Creatine phosphokinase test. See, acid phosphatase test is useful when there is aspermia or azoospermia. Only under aspermia or azoospermia, acid phosphatase test is beneficial. For older stains, the two in garments, dried seminal stains are older, ideal test is creatine phosphokinase test. And one more option that we should know about is the single positron fluorimetry. This is to identify semen. In case of mixture of semens, you can differentiate semen belonging to each individual, right? For mixture of seminal stains, single positron fluorimetry will be useful to differentiate mixtures of semen from more than one individual, right? So older seminal stain, creatine phosphokinase test is the answer. Then another easy question, factual question, hands down question. Marshall's triad includes aberration, contusion, laceration, and bomb blast injury, right? Blast injuries. Blast injury contains aberration, contusion, laceration. To be precise, this laceration will be punctured laceration, right? Punctured laceration. See a touch and go question, factual touch and go question. Punctured laceration, aberration, contusion, punctured laceration. Then next question, Grievous cert. See, now Grievous cert is defined under section 116. Section 116 of BNS, Bharatiya Nyaya Samhita, right? Bharatiya Nyaya Samhita. Section 116. See, earlier it is section 320 of IPC. Section 320 of Indian Penal Code. Now it is section 116 of BNS. So as per this, only change with respect to BNS is the days of 15 days. See, with respect to 320 IPC, the days limit is 20 days, the class 8. Any act that endangers life or keeps the person to be in severely body pain for a period of 15 days with respect to 116 BNS, the latest amendment. Please remember 150. So earlier it was 20 days according to 320 IPC. So in future, the question is about days limit. In Grievous cert 116 BNS, answer shall be 15 days, not less than 15 days. So answer for this question, Grievous cert do not include pain for 5 days, right? Yes. So dental formula. See, this question is a bit moderate to tough question. See, this universal dental formula goes like this: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, then up to 16. Then it starts as 17, 18, 19, goes till 32, right? 32. 8 teeth, fourth quadrant, 32. Right. So serial numbering, right? Serial numbering. So 16 teeth in the upper quadrant, 16 teeth in the lower quadrant. Universal. So Palmer notation is quite different. See, Palmer notation goes in this way: 1, 2, 3, 4, 5, 6, 7, 8. And 1, 2, 3, 4, 5, 6, 7, 8. Here, 1, 2, 3, 4, 5, 6, 7, 8. It goes in this way, right? So right and left, right, left. So palmar rotation is starting from 1 to 8 in each quadrant, right? From medial to lateral. You get it. Then hand rub is the same like palmar rotation, but there is usage of plus for upper quadrant teeth, and negative symbol minus for lower quadrant teeth. So all the maxillary teeth will be represented by the symbol plus, mandibular teeth will be minus, right? Hand rotation. So modified FDI and FDI, they are called two-digit systems, right? Two-digit system where first digit indicates the quadrant, right? Quadrant 1, 2, 3, 4. So if the teeth is 1, 1, 1, 2, 1, 3, 1, 4, it goes in this way 2, 1, 2, 2, 3, 2, 4. Here it is 4, 1, 4, 2, 4, 3. Here it is 3, 1, 3, 2, 3, 3. So right and left, right? Okay, so two-digit system. So modified FDA and FDA are two-digit systems. The first digit represents the quadrant, the second digit represents the T. So how to differentiate modified FDA and FDA? Simple. See, modified FDA, the number is 1, 2, 3, 4. Whereas in FDA, the quadrants will be like the same, but the number will be like clockwise 1, 2, 3, 4, right? Clockwise. So FDA. Modified FDA 1, 2. Modified FDA is 1, 2, 3, 4, right? Yes. So poison turning black with silver nitrate is this. See, another tough question. Don't worry about it. I'll show you few more repeated questions out of this. So oxalic acid with barium nitrate gives a white precipitate. Hydrochloric acid with silver nitrate produces white precipitate. Parathene with sodium hydroxide produces yellow coloration. Here, answer for black with silver nitrate is aluminum phosphide. So black with silver nitrate is aluminum phosphide. Black. So aluminum phosphide, second most common poisoning in India. It is an agricultural poisoning. So it contains phosphine, the phosphine gas. So phosphine is responsible for the black precipitate, phosphine gas, right? Phosphine causes cardiogenic shock, phosphine. So phosphine is responsible for black coloration with respect to silver nitrate. So another silver nitrate test is with respect to hydrochloric acid where you get white precipitate, right? So silver nitrate black, aluminum phosphide, right? Okay, so thank you.